I started having pelvic pain issues about 10 years ago. It started out as what I thought were GI issues, but became more and more all throughout my lower abdomen and my pelvis. My pain was really hard to describe, and I found it challenging to explain exactly what was going on with me. I would describe pressure, tenderness, twisting, kind of all over the place, and I wasn't sure, is this a reproductive issue because I'd always had painful periods? Is this a digestional issue? What else is going on with me? I don't understand. When I first started experiencing pelvic pain, I realized that even when I was on vacation, what I could do was very limited. So I went from being able to go to the beach and go swimming and on boats and hanging out with people to really just kind of wanting to sit in a beach chair because I was so uncomfortable. And now, as I've been finding things that help me manage my pain, I find I can be much more active. I do have to be careful about how I take care of myself throughout the day, but it's a big difference for me to be able to go on vacation. Yeah, the pain impacted my life pretty tremendously. I went from being very active, working full time, traveling all the time for work and for pleasure, and realizing that it reduced what I was able to do every day. So I couldn't do some of the things I enjoyed to work out. I did Pilates, I ran, I took spin class, and I really didn't have the energy to do it. Friends would ask me to go out to dinner, and I'd made it through a day, and all I wanted to do was to go home and lie on the couch with a heating pad. So it really had a big impact on my life. My first experience with a really extensive history. I mean, she went back very early to my very early medical history and asked me questions that I had never really thought about, and realized things that I'd experienced even before my pain really became an issue were impacting my health. So it was very, very extensive, and I appreciated the way that she was thinking about it in a multifaceted way because it felt like my pain was pretty multifaceted. The treatment that I've found works is very multifaceted. It's actually probably an understatement. I have so many different doctors incorporated in my treatment plan, and it was really, in some ways, through referral, and other ways through trial and error. So I have a GI doctor, I have a pelvic pain OBGYN, I have a orthopedic pain specialist, I have a physical therapist, naturopath to help with diet and supplements, couple yoga instructors, a therapist, an acupuncturist. When I think about all the things that I do as part of my treatment plan, I would say they really do have to be integrated. There isn't one element that I think is more important than the other. It can really vary, especially when you're female and I find my pain varies throughout the month and through your cycle. So I think they're equally important. I find that the pelvic pain program helps me because now I have a group of doctors who are working together, communicating together, and that was something that I didn't have early on in my journey in managing my pain. They work together to identify whether my treatment plan is currently working or not, and then also identifying who it is that I should be seeing at the right time. If I were looking at myself at the start of this journey, I would say don't give up. You have to just keep talking to people, explaining what you're experiencing, and exploring what the right options are for you. What worked one month didn't work another month. One doctor's advice was something maybe that I wasn't ready to try, but I would consider maybe a couple months later, incorporated with something else that another doctor suggested. So it was all about this process and not really ever giving up. I mean, I'm still in that process, but I feel fortunate that I found a group of doctors who adjust with me, learn with me, and make great suggestions. I would say to someone in my shoes, choosing where to go for treatment, and what to do next, that Stanford Hospital is a great place to feel as if you're taken care of, because you want to feel a sense of comfort, not just that, these are very smart people, because you can find pretty smart people in a lot of places, but you want to make sure that you feel like you're taken care of and that you have a variety of treatment options available to you. And that's something that I felt with Stamford Hospital. I think the strength of Stanford Hospital has been the people. From doctors to nurses, everyone has really been helpful, inquisitive about me as a person and as a patient, and I think that made a really big difference for me.
For more information about the pelvic pain program at Stanford Hospital, please call us today.